Hello, everyone. Um, just want to thank you all for joining us today. Okay, great. So I just want to give, as we start waiting for people to join the Zoom, I'm just going to give a brief introduction to Girl Up. So, hosted at the United Nations Foundation, Girl Up works within global communities to advance gender equality in over 100 countries. Girl Up is a global movement of empowered young women leaders who defend gender equality, equal rights for every woman and girl. Our girl leaders create real policy change at local and national levels, raise millions of dollars to support programs for tens of thousands of girls across the world through our UN partners, and build community-based movements such as this. You can learn more at girlup.org, and you can also find more about our webinar series, Exploring COVID-19's Intersectional Impact on Women and Girls Worldwide, on our website, tinyurl.com/GU webinars. Also, as we wait for more people to join, I just want to go through the guidelines of today's session. So Girl Up Edinburgh will not tolerate any and all forms of hate, bias, microaggressions. If you are engaging in this event in an inappropriate manner, then you will be kicked out of the event. Please mute yourself on arrival and remain muted when you are not speaking. We want to hear from you. This is an interactive discussion, so please, we really encourage you to use the chat feature to engage with our panelists. Ask them questions, share your experiences. We really want this to be as interactive and engaging as possible. And to questions, so send any questions you have to specific panelists or to the entire panel throughout the session using the chat feature. And just a reminder, this event is recorded, but feel free to show your lovely face if you feel comfortable using video. If not, no problem. And please show the moderators, panelists, our translators, Louisa and Thea, respect and your utmost compassion and patience. You know, we're trying to work on this all together. So I think now we'll start getting in, but just before we start the webinar, I'd like to inform you that we will be discussing content such as sexual abuse, domestic violence, exploitations, and gender-based violence in this context. So if this can be triggering for you, just to let you know that this is what we're going to be discussing. Okay. So welcome to the first panel discussion of Girl Up Edinburgh's webinar series entitled Exploring COVID-19's Intersectional Impact on Women and Girls Around the World and Worldwide. The aim of this month-long webinar series is really to unite women and girls by presenting commonalities in our COVID-19 experiences, while highlighting how intersecting factors including race, gender, sexuality, ability, class, as well as political, economic, social, and environmental considerations can uniquely exacerbate the pandemic's devastation. Today, with our incredible speakers, Ami Bishop from Outright International, you can do a little wave. You can do a little wave when I say your name. Dr. Rhonda Von Shea Sharp from WISER, Women's Institute for Science, Equity, and Race think tank. Shirley Liu from the Asian Pacific Institute on Gender-Based Violence, Dilraj Soki Watson from the Amina, the Muslim Women's Resource Center, and Erica Perez from the Network/LARED. So together with them, we are engaging in an intersectional discussion on the shadow pandemic. So what is the shadow pandemic? So the UN coined the term the shadow pandemic to describe a pandemic running rampant across the world in parallel to this coronavirus pandemic. This refers to the rising rates of gender-based violence experienced by people, especially women and girls across the world. Even before COVID-19 existed, gender-based violence in all forms was one of the greatest human rights violations. Women and girls have faced violence from family and individuals, from the state and institutions. Women and girls have dealt with formidable barriers to aid and support due to lack of funding, lack of intersectional services, and an unjust and untrustworthy legal system. And COVID-19 has exacerbated all of these problems and factors. Now to turn a little bit to what intersectionality means, as this is an important element for our discussion. Coined by Kimberly Crenshaw to address how the anti-racist and feminist movements were overlooking the unique challenges experienced by Black women, intersectionality espouses that there are many forms of oppression, which when compounded, it transforms the experience of oppression, inequality, and discrimination. Employing an intersectional lens enables this webinar series to investigate how intersectional factors such as gender, race, sexuality, class, ability, as well as religious and cultural factors can impact women and girls' GBV experiences. So GBV is gender-based violence. And gender-based violence exists in a continuum of complex and interlinked experiences of harassment, violation, abuse, assault in the lives of women and children. GBV includes, but is not limited to, domestic abuse, rape, sexual assault, sexual harassment, commercial sexual exploitation, and so-called honor-based violence, which continue to be prevalent across society. GBV is also multi-leveled. It is present in interpersonal relationships and in structures and institutions. So now that we've kind of gone through a little bit of introduction of the key terms and ideas that serve as the basis for this discussion, we are going to turn to our incredible panelists and let them speak a little bit about themselves, about their organization, and the impact of COVID-19 on the community that they serve. And we are going, and just to let you know that, just to introduce myself quickly, I'm Shira Graubart, I'm president of Girl Up, and my pronouns are she/her. So I'm gonna start it off with Ami.
Thank you so much, Shira, and all of Girl Up Edinburgh. I really appreciate being part of this conversation and being with such esteemed co-panelists. So thank you so much. My name is Ami Bishop. My pronouns are she, her. I'm a global health and human rights consultant, currently working for Outright Action International as its senior research advisor. I have also a long professional history in global public health, women's sexual and reproductive health as well, HIV. Just a couple of words about Outright, as we call it for short. Our organization is based in New York City. We've been in existence for 30 years, defending and advancing LGBTIQ human rights and equality globally. We have a global reach. We have staff and board in 8 countries. And we work through 3 primary programmatic strategies. The first is, well, they're not really in any particular order, but research to provide evidence and documentation for advocacy on specific issues related to LGBTIQ equality and justice. Movement resourcing, so we try to bring attention and resources to national movements around the world with whom we are working closely in partnership. And then of course, advocacy kind of underpinning all of our work at national, regional, and the global level. And at the global level, we do a lot of work with the United Nations, working very hard to get LGBTIQ rights on the agenda, on the global agenda of human rights. So let me just turn quickly to the work that we have done specifically related to the pandemic. When the crisis first emerged, we decided very quickly to undertake some rapid research on the impact of COVID on LGBTIQ people globally. We did a literature review to look back at the ways in which our communities were treated during past emergencies and crises. But the real heart of the work was in-depth interviews with 59 people from 38 countries around the world. We did this work because we wanted to sound the alarm about what was happening in our communities. We're rarely included in data, and we know that in times of crisis, the most marginalized will suffer disproportionately, as we've been seeing across various populations all over the world. LGBTIQ people are certainly among the most marginalized in many countries, especially where we are criminalized. And so for those who may not be aware, 68 countries currently criminalize homosexual behavior. 9 still have the death penalty. 45 countries apply such laws to women, and about 57 countries criminalize in one form or another transgender people. So, so there's that backdrop, and then there's also the issue of the way that gender is defined. And one of the points and why I'm so glad to be able to be part of this panel is that we know historically, and actually from what is happening now in the COVID response, that responses to emergencies tend to use a very narrow gender lens and don't take strong intersectional approaches to response. And so even those that are considering specific gendered impacts of crises use a narrow cisgender and broader needs of people with diverse sexual orientations and gender identities. And this is quite problematic because this kind of framing really overlooks the specific barriers to support that queer people may be facing because of their sexual orientation, gender identity, or sex characteristics. So we conducted this research at the end of March, early April. So things have, the world has, the pandemic has moved on, and we captured a moment in time, actually even before the pandemic had become as bad as it's become in many parts of the world. Nevertheless, even at that early stage, 7 themes emerged in analyzing the interview data that pretty well characterized the impact of the pandemic on queer people, and has continued to be validated over time. So the themes, and I'm just as very quickly, but just to give you a sense, devastation of livelihoods and increased food insecurity, disruptions in healthcare access and reluctance to seek care, increased isolation and anxiety, scapegoating, and increased risk of societal violence, that is, queer people being blamed for the pandemic, increases in abuse of state power, and concerns about organizational and movement survival. And I'm saving the issue of violence for last, although that was a very dominant theme. The way it looks based on our interviews is really about violence due to forced cohabitation with unsupportive family members. So especially young people who are forced to either leave school or have lost their jobs or their housing, who had to return to their families of origin, be completely cut off from safe spaces, and from their chosen families, are suffering definitely from domestic violence. So, and we know that LGBTIQ people around the world face disproportionate levels of violence in so-called normal times. And I hope we'll talk more about this, but the roots of this violence are really very similar to those affecting cisgender women and girls more generally. And so they're definitely the issues of societal norms and breaching societal norms and patriarchal structures. So I hope we'll get into that. The other point, just referring back to the issue of criminalization, is that in those kinds of settings, you see an increased, the violence tends to be done with greater impunity, both at state and within sort of domestic or personal spheres. So I'll stop there. That gives you a taste of what we've been focusing on over the last few months, and I'm looking forward to the conversation. Thank you.
Thank you so much. Now we'll turn to Shirley from the Asian Pacific Institute on Gender-Based Violence.
Hi everyone, my name is Shirley. I go by she, her pronouns. I work at the Asian Pacific Institute on Gender-Based Violence. It's a very long name, but essentially we're a national organization that's based in Oakland, and we have satellite offices in different other areas. We are a resource center, a technical assistance provider, training provider. We also do research and advocacy on forms of gender-based violence affecting Asian, Native Hawaiian, and Pacific Islander survivors in the US. And this is anything from trafficking to elder abuse, to family violence, sexual abuse, forced marriage, abusive international marriages. We don't work directly with survivors to provide services, but we work with folks all across the board who are advocating for survivors and who serve survivors. So that would include lawyers, law enforcement, policymakers, medical staff. And we work with them to provide them training and information on the different barriers affecting Asian and Pacific Islander survivors in particular, and ways that they can address these barriers, ways that they can provide, for instance, language access, immigrant protections, help them apply for immigrant protections, and so on. The most important part of our folks that we serve are what we sometimes call community-based organizations. So these are, they tend to be fairly small communities, engaging the communities, serving survivors. They work in shelters, and they're the frontline folks who are serving survivors of domestic and sexual violence. And our role is really to provide whatever they need to build up their capacity to best serve their folks in their communities, whether that's help applying for grants, board and staff development, information on how to build a language access model and language access plan, how to best serve survivors of a particular religion, cultural group, how to best serve refugees or immigrants. So I say AAPI or API, meaning Asian and Pacific Islanders, but it's really a very broad category. It's anything, we have folks who serve anything from, West Asian, Middle East, to Pacific Islanders, Native Hawaiians, East Asian, Southeast Asian, South Asian, just Central Asian. So it's a very wide and varied, group of folks that we serve. There's over 55 ethnicities, over 122 languages within the so-called AAPI population. One of the most prevalent myths out there, at least in the US, is that Asian and Pacific Islanders don't experience much family violence or much domestic violence, and that's simply not true. That's a myth. In our literature reviews that we've done, we've seen that somewhere around 21 to 55% of Asian Pacific Islanders have experienced domestic violence or sexual violence from an intimate partner. And it's not a matter of them not experiencing the violence. There's barriers to finding access and barriers to reporting the violence that's making the numbers appear very low. So we operate primarily in the US, but as I said, our folks that we engage with and folks that we serve come from all over, there's a lot of international folks in there. So our job is really to provide a culturally specific lens. We focus a lot on, it's become a buzzword now, but what we mean by culturally specific means providing services that are meaningful given the survivor's cultural background or where they come from. So nice to meet you all.
Thank you so much, Shirley. Now we are going to turn to Dilraj from the Amina, the Muslim Women's Resource Center located in Scotland.
Thank you, Shira and Gulab, for this opportunity. I'm honored to be here. My name is Dilraj and my pronouns are she/her. And I work for an organization called Amina, the Muslim Women's Resource Center. We are a national women's charity based in Scotland. And our head office is in Glasgow, and we've got 2 other offices in Dundee and Edinburgh. We serve the needs of the Muslim and BAME community across Scotland, and on an average, we engage with about 3,000 to 4,000 women across the year, across a range of services. Our key areas of work include what we call the National Signposting and Listening Ear Services, which is our helpline service. We also offer a program on violence against women, which is doing a range of campaigns and prevention work, which I'll be getting into more detail later into the conversation. We also work on a series of community-based projects that build community resilience and support women experiencing poverty or at risk of falling into poverty or experience violence. We necessarily don't provide frontline service to survivors, but we do kind of do a lot of advocacy and preventative work on that front. And we also do services like befriending services, friendship groups, where we engage with women in one-to-one basis and encourage them to wider participation in civic life and other activities. I'm not familiar with the range of people who are watching this program, the session today, but if any of you are from the UK, you might be aware that BME communities have been disproportionately hit by COVID in the UK. Early research in March indicated that there was disproportionate health impacts on BME communities in England. And based on that, we started kind of working in Scotland to see what's happening. So very early into the pandemic in the UK, we issued a survey across different platforms, face-to-face channels, we spoke to our service users and members of the community, trying to identify issues which have impacted them and which have been exacerbated by the pandemic. We also did an intense phone outreach all through the months of mid-March, April and May, where we were speaking to women about the issues that are emerging. And there were significant issues which I'll be kind of going into briefly. Some of them were around financial capabilities, which we are aware that the demographic we work with and engage with are quite disengaged already. And these economic kind of barriers were intensified due to COVID. We also saw a lot of mental health impact on the well-being of quite a few of our service users and community members. Not much spoken about it in the early stages of the pandemic vocally, but we did see a significant impact on well-being. We also saw, we've got a service called the Hardship Fund, where we provide emergency funding to women who are going to be at risk of being destitute or are at risk to access grants to support them into what might be the next line of support. And we saw an incredible amount of requests to access to the Hardship Fund during that period. As I mentioned, we've got a helpline, our national signposting and listening ear service, and we, strangely enough, in the initial days of the helpline, during the COVID period, we saw a drop in our helpline calls, but about 3 or 4 weeks into lockdown, we saw some spike, and since then, our helpline service has been quite busy as well. We also saw an increased demand on our befriending service, which is volunteers reach out to members of the community to connect with them, to kind of provide them support, and we saw an increased demand for the befriending service during that period as well. What have we done in response to that? We've been fortunate in some ways to have access to funding to address some of these issues in the short term. But there are a couple of issues which kind of are almost amplified. One is what we call the digital divide. I actually feel quite privileged today to be able to sit in a room on my dining table and be able to engage with a wider audience across platforms like Zoom. But we are talking about women who do not even have access, leave alone skills to have technology in their hands. So what we were looking at was there was a marked digital divide within the community, and it further exacerbated the inequalities within the kind of communities we work with. We've also seen, this is anecdotal data, but we've also seen a rise in hate crime against Muslim and BAME communities online, because it's not like hate crime didn't exist. We've got legislation going through the Scottish Parliament at the moment, which we are feeding into. But what we've noticed is a lot of that has now gone online because everybody seems to be kind of accessing a lot more online content. So we've seen a visible rise in that. And in Scotland at the moment, while the initial review indicates that the BME community has not been disproportionately impacted by COVID health-wise, but there's already the work we're doing at the moment in partnership with the university. We are observing the inequalities across healthcare access and financial engagement as well. So necessarily not just health, but healthcare access and financial access. We work with the particular kind of focus of women who may be single mothers or are singular income earners in the household, and we've seen a disproportionate impact, financial impact on women for a number of reasons. If they are the primary caregivers in households, with the whole school from home situation, work from home situation, the first individual who might get impacted is the woman if she's having to take care, if she has to take on the onus of care, additional burdens of care. So we've seen impacts there as well. There's also been impacts on refugees and asylum seeker women from those backgrounds because they don't have a recourse to public funds and got worse. But yeah, that in a nutshell is what's happening on the ground at the moment. But I'm quite looking forward to the session today, and I'm happy to share further insights on this and listen to what others have to say. Thank you.
Thank you so much. Now we are going to turn to the fabulous Erica Perez from the network/LaRed.
Hi, thanks Shira for inviting me to this panel, and thanks for extending the invitation to us. My name is Erica. I use any pronouns. I am the Community Awareness Associate for the network LaRed, which is a survivor-led organization based in Boston, Massachusetts. We're working to end partner abuse, or as most folks know it, domestic violence, in LGBTQT, polyamorous, SM, and kinky communities. So a lot of what we do is, I guess, divided into components. We do provide direct services to survivors. So we have a 24/7 hotline that's available to survivors. We have a support group for LGBTQT survivors that is phone-based. So thankfully, COVID hasn't impacted that too much. We are also trying to get a support group specifically for Black and Indigenous LGBTQT survivors. So if anyone's interested in that, please let me know. So we're going to be starting that up soon. We provide advocacy for survivors as well. And advocacy can look like a lot of things. It can be court accompaniment for appointments. It can be accompaniment to medical appointments as well. It can be helping survivors look for housing resources. So that's a little bit about what advocacy looks like. We also provide supportive counseling for survivors too. We have a wonderful housing program, which we are really proud of, that consists of two things. One, which is emergency housing. So what would typically be considered a shelter. Emergency housing at a confidential location of a survivor's choice. And we also offer transitional assistance for survivors, which looks like financial help. Help in securing an apartment or in paying for rent. On the other side of things, we also do provide community outreach, and that's actually a lot of what I do. I go to community events, things like Pride, things like conferences. I table at these events and talk to community members about partner abuse and what it looks like in our communities. We also do provide trainings both for providers and community organizations about partner abuse in LGBTQ communities. And we also do a bit of community organizing, which is really something that I'm proud of as well. We're trying to make a space for survivors to come together, and have agency in what they wish, have agency in the topics that they want to talk about out in community. One thing that I do want to note for this panel is that gender-based violence is not a term that our organization uses. During my research for this panel, actually, when I did some looking up about what gender-based violence is, I feel like it's used a lot interchangeably with violence against women. And when we talk about partner abuse or domestic violence, and we talk about violence against women, we're really referring to violence against cisgender women because of transphobia. And so what I'm going to be sharing throughout this panel is mainly the experiences of survivors who belong to our communities, who are not cisgender women, who are transgender folks, trans women, non-binary folks, gender non-conforming folks. So I'm going to be sharing that perspective as well. And I'm also going to be using the term partner abuse, which, like I mentioned already, folks know more of as domestic violence, and that's because I want to be inclusive of the communities that we work with. And I feel like when you say domestic violence, you get a certain picture in your head, right, about who is a survivor and who can be abusive. So that's a little bit about the work that we do.
Well, Erica, thank you so much, and for presenting that nuance that's definitely needed in this discussion. Now, last but not least, we are going to turn to Dr. Rhonda Von Shea-Sharp from the WISER think tank, which is the Women's Institute for Science, Equity, and Race. Leave it up to you, Rhonda.
Thank you, Shira. Like everyone else, I was really surprised, right? Which is where Shira got my name. I was quoted in an article by Tamara Jeffries, who's the associate chair and associate professor of journalism at Bennett College, which is one of 2 historically Black colleges in the United States. So I am the president and founder of the Women's Institute for Science, Equity, and Race. I am so glad to be following Erica and hearing her say inclusive, because the reason we exist is often you read reports that say women, but they're not talking about Asian, Black, Hispanic, Indigenous American, and multiracial women. They are talking about white women. And when they do talk about non-white women, it is, we're between the commas and it's deficit based. So it is women except, or there's a paragraph and it is also deficit based. And to follow, I think surely you often don't hear a conversation about Asian women, and we won't even talk about if you're talking about the lesbian community, right? It's like there will be minimum mention of those. So our primary purpose is to create reports that don't do comparisons, to include the cultural, economic, political, and social needs of Asian, Black, Hispanic, Indigenous, American, and multiracial women. Now, I don't normally use the term women of color unless I've defined it, and since I've defined it, I can now say women of color. Shira said at the beginning of this, she talked about intersectionality. We advocate for the disaggregation of data. And there's a disaggregation of data is the mechanics. So we want people not to report on women, because when you do report women, you are biased, and the assumption is that white women are the norm. And we also ask people not to report by race or ethnicity, because when you do, then white becomes the norm. So we ask folks to disaggregate depending on what you think influences the outcomes. So in an instance in talking about gender-based, partner-based, domestic violence, whatever it is where you are, we would advocate that you disaggregate that data if your data set allows by, and Erica, you can correct me, I'm going to say sexual orientation, sexual identity, as well as thinking about income, household structure. Is there the presence of children or not? All of these things we find are important, right? I will talk a little bit later about the economics behind gender-based violence, not just in terms of what the households look like and what kind of households we see financially that tend to have a higher incidence of gender-based violence, but also the cost of gender-based violence. And I'm using that term because of the panel. Let's see, I don't interact with the public, I want to put that in quotation marks, our goal is to create reports to influence policy. So I primarily use large data sets. We'll be looking at a new data set that's come out by the Census Bureau on the Pulse, which is very much focused on COVID-19. For the last couple of weeks, our focus has been on getting folks to disaggregate unemployment data, to expand that conversation around unemployment, not to focus just on Hispanic and Black women, to get BLS to disaggregate that data for Asians, to report numbers for Indigenous Americans, and for folks to pay attention to what's happening with white women. So that's a little bit about what we do, and we're probably the youngest organization here, as we're only 4 years old. So again, thank you for the invitation, and I'm excited to be a part of the panel.
Well, thank you so much to our panelists. Before we kind of turn to the discussion, just some housekeeping rules. Just to let you guys know, our panelists are really encouraging interaction and engagement. So please send in your questions and your comments, and our panelists will engage with you in the chat feature if the conversation on the video has kind of moved forward. I would also like to remind you that if you have any specific queries regarding subtitles or any of the tech side, you can privately message Girl Up Edinburgh. Closed captioning and subtitles are available, and you can click that on your bottom right hand. I would also lastly like to say that these are incredible panelists, and we're so honored to have this just immense knowledge in this room, and that all of the money that is raised for this event is going to these organizations. So if you would like to support these organizations and the work that they do, you can go to our Eventbrite and sign up for a donation ticket, and that's where your money will be going. So before we begin this discussion, I just want to explain the format a little bit. So we will begin by exploring kind of the commonalities of GBV experiences to kind of provide an outline of GBV and what that is. We'll then enter into a discussion on structural violence performed by state regimes with a focus on health, social, and relief services, as well as touching on economic insecurity and the justice system. Then we will turn to violence that is rampant in family regimes, touching on partner abuse. And then we will end the discussion looking outward towards policy solutions and intersectional initiatives that government, civil society, and us as individuals can utilize. So as we know, I mean, these issues that are affecting women and girls across the world, they are very similar. However, they manifest very differently in each community. And this discussion will be structured based on the different levels of where violence occurs. I just want to reiterate to my panelists, you guys can jump in whenever you want to answer a question or give a little comment. So I wanted to kind of ask you guys, what does violence mean? What does violence entail? And how does it manifest?
I think violence can mean many different things. In the scope of the work that we do at TNLR, where we're talking about partner abuse, violence can manifest in a lot of different ways. It can manifest as emotional violence, it can manifest as economic violence, as sexual violence, it can manifest as abuse or violence related to one's culture or identity. I would also, I guess, invite us to steer away from like what we typically view as violence being, which is physical violence, right? The act of hitting or pushing, those sorts of tactics, because there are many other tactics that someone who's abusive can use in order to exert power and control over someone else. One of the things that we see a lot in our work when working with LGBTQ folks is that because of this misinformation or miseducation of what domestic violence or partner abuse looks like, folks are unable to really recognize patterns of control or power over someone else in a relationship where abuse is happening. And so we really need to train ourselves in, or educate ourselves on what these different patterns of control can look like. So for example, in the LGBTQT community, we see a lot of our survivors' identities being used against them. So we see a lot of, how do I say this? We see a lot of use of slurs and use of one's gender identity against the survivor. We see a lot of using outing someone as a method to exert power and control over someone else, which can influence a survivor's which can influence a survivor's economic stability, right? An abusive partner can say something like, if you don't do what I say, then I'm gonna out you to your employer, or I'm gonna out you to your family who's paying for your college, or who's paying for your apartment. So we see violence or abuse manifested in many different ways.
Mm-hmm. And kind of touching on this conversation, kind of what are like the cause, I mean, this is, a whole session on its own, but what are some of the causing factors of GBV, and what role does inequality play in GBV?
So I think I'll chime in on that one. And again, Erica, I think it is just perfect that, I'm going to be following you. So I like the definition, reminding folks not to think about the physical violence, but the intimidation. So from an economic standpoint, what we find is there's often the threat of one's livelihood, right? So you'll find that the threat of financial well-being. If I think often the more common term can essentially in some ways be thought of as bullying, right? But bullying is definitely a form of intimidation, a form of abuse to get someone to behave in a particular manner. But there is also, and I want to make sure I get this right, there's also research that suggests that if you think about household incomes, and that the assumption is that your higher incomes don't experience gender-based violence because, again, the assumption is that there are more resources there so that if there's this presence, you can exit. But we often forget that in higher income households, you may be more likely to have a woman who is staying at home, and it is actually the husband who, it is actually the partner, because it may not be a husband, who is the primary breadwinner, and so that can be an issue. So if we think about the range for income that tends to have a higher incidence per 100,000 for domestic violence, it's the 15,000 to 2499. And those are US dollars, right? So those are your lower income households, which you can imagine are facing incredible amounts of stress, both outside and then coming home. And then when you head up, it's the folks who are 50 to 75 and 75 to 100 have rates that aren't very similar. One of the things that we have been incredibly concerned about with COVID is the number of folks who are working from home, right? Which means that there's an added, and someone mentioned this, I believe I that there's the added level of stress of dealing with work and then also dealing with children. And I think if you are what people like to refer to in the US as essential workers, I call them expendable workers. The job is essential because quite often they're not getting the personal protective equipment to protect them. That's an additional threat, right? That you're going out and you're coming in, that you may actually bringing the virus back home. That creates a different level of tension in the household. Now, the other side of that is the cost of domestic violence, the hours that can be lost when someone is being abused, the ability for them to actually be productive at work, what we see in terms of the mental costs are conversations that we don't have. And so I think the biggest way that inequality shows up is there are assumptions about the socioeconomic status and what groups that happens in. There are assumptions about what religious groups that happens in. And when you presume or you place value on another's group, the ability for that group to actually speak out about the violence that they're experience, whether that is physical or intimidation. I think there is a devaluing, a demeaning of that person and their experience, inequality, as well as the resources.
Shira, I'd like to bring in an intersectional lens to this discussion. Erica mentioned power and control, which essentially is just echoing what Erica said and adding to that, is actually at the center of GBV. But one of the kind of layers when you add on to that, especially in the context of Muslim BME communities, is what you call the essence around honor. Honor as in, you know, the whole burden of the family, the community, the burden of pride and honor lies on the shoulder of, in this instance, women, and using that as a means of coercive control. And, you know, on the face of it, we use something called Muslim Wheel of Domestic Balance, which is based on the original Wheel of Domestic Balance, and it's kind of contextualized to BME communities and Muslim communities, using the same kind of format where we're looking at coercion and threats, using intimidation, using emotional abuse, using isolation, denying access and blaming, using children as a tool, and using male privilege, and using economic abuse. So just to put it in context, that while any of these spokes of the wheel can be used as a means, in the center of it, it is about power and control. When you add intersectionality as a layer to it, when you talk about honor in the context of communities where, you know, we say, okay, religions promote a certain lifestyle, or religions or culture promotes, it then becomes a lot more difficult, because people who are living and experiencing that violence are able to, while they understand the nuances, they necessarily don't feel empowered to step out of it. And we've come across this it's quite prevalent, where we're talking about trying to rescue our sisters from those cultural shackles. And I think the word rescue or the word uplift itself needs to be reconsidered, because it's not that they need rescuing or uplifting, it's about an increased understanding of what these norms actually mean and what impact they have. So I'd just kind of like to add that there's a lot more nuances than just kind of the basic.
Could I jump in? I think that's such an important point, and I just want to also set a little bit of a context, because we do work globally, and so there are a couple of key points here. One is that when we talk about LGBTIQ populations globally, it sounds monolithic, and it's so far from that, and we really have to stay very focused and grounded in you know, in cultural and religious and economic realities in many different places that have impact. And then once you break up those letters and you look at the ways that violence impacts lesbian women, bi women, non-binary people, transgender people, trans women, trans men, gay men, you know, they manifest very differently. And I think it's hard to talk about the issue without collapsing, and I try not to collapse. Let's just say that, although I might catch myself collapsing nevertheless. But I want to just point out or pick up on the issue of the definition of violence in our communities. Really, it spans the personal sphere all the way to state. You're talking about, in many contexts, people whose faith, whose family, whose cultural traditions or beliefs are rejecting them fully. And when you experience that full and comprehensive rejection, that in itself is a deep personal and psychological violence to one's own being. And so you are already potentially in a place, depending on the resources that you might have to sort of cope with that, at a very vulnerable, I guess, although I don't love using that word either. But and I think too that where you see then what's happening. I mean, Rhonda, you mentioned bullying. I mean, from the very start, bullying in schools, queer kids across the world are routinely bullied, and this sets, unfortunately, a kind of pattern of being subject to powers and controls that they can't escape, and that in turn sets up a path of ultimate disadvantage when it comes to employment and it comes to furthering your education. So it's very complex. And the one other issue I want to mention, just because it's also an area that I've done some research on, is that a form of violence that is, I think we've sort of heard about but don't talk enough about, is the notion of so-called conversion therapy, perpetrated by families, perpetrated by religious leaders, perpetrated by the medical or mental health profession. The very act of trying to change who you are, regardless of the means, and some of the means can be very traumatic, it is also an act of violence. So we tend to talk about violence in a fairly expansive way, because unfortunately it manifests in many different forms, and so we try to be mindful of that.
Can I jump in, please?
Yeah, sure.
So Miss Emmy mentioned bullying, and I would like to share my experience with bullying. So I used to get bullied when I was in a middle school. Now I'm in a senior year, and I can feel like I'm powerful more than ever, because I was getting bullied the entire middle school, and because I wasn't like those girls, and they don't like me, and I tried to change myself. I tried to change who I am, and just to be a part of that group, but they rejected me every time, and then I realized that weakness point, I changed it to a powerful point. So I try to love myself the way I am, to satisfy anyone. And yeah, I think every single girl should learn how to be herself, and to try to change yourself to be in a part of group, or to talk to that girl or something. And yeah, that's the thing that.
Yeah, well, thank you so much for sharing. Erica, do you want to respond to that?
Yeah, I mean, thanks for sharing that, Visel. I think I pronounced your name right. I'm sorry if I didn't. Thanks so much for sharing. For sharing that experience. And I would say, not just for girls, but for everyone, right? For boys, for folks who don't identify with the gender binary. Yeah, so thank you for sharing that experience. And I also wanted to touch upon a little bit about what Ami and Dilraj and Rhonda have been talking about in terms of inequality, and how, just like Ami mentioned, we grow up in societies where LGBTQ+ folks aren't really valued, or seen as human even. One of the big things that we focus on at the network is how we see partner abuse as reflecting and running parallel to systems of oppression within our society. So we see, if we think about how we grow up, and when I say society, I'm going to be very specific to like United States society, because that's, I guess, the point of view that I have as someone who grew up and was born here. But in the US, as we grow up, we learn how to exert power and control over people and over groups, because our governments do that, because our institutions do that, because our family members and our friends can also do that as well. So from a very young age, the fact that it's okay to exert power and control over other people is ingrained in us. And not only is it okay, but it's actually, it's rewarded. And we can see a lot of instances of that within our government, within our elected officials. And so just as how we're not born racist, you know, transphobic, homophobic, classist, you know, just as how we're not born these things, we're not born with these messages ingrained in us. We're also not born like abusive. That's something that we learn from society at large. And it also ties into another, I guess, important distinction in our philosophy, and that is that abuse is a choice. You know, that folks choose to abuse other people. Like, we all know how to manipulate. We all know how to be abusive. It's a choice that an abusive partner makes in order to use that power and control over someone else. So, you know, all these systems of oppression that we see in our society, I mean, like you mentioned, homophobia, biphobia, transphobia, abusive partners use that, you know, and replicate that within interpersonal relationships. So I just wanted to add that.
Yeah, well, I just wanted to thank you for sharing. Unfortunately, since we're just low on time, we're just going to be asking for you to share your experiences through the chat feature, just so that we can get our panelists to answer our budding questions, and then our panelists can respond to your experiences in the chat and reach out for further, you know, talk for further support. So just kind of wanted to direct this question to Shirley, as well as our other panelists who have kind of explained a little bit, but how do intersecting factors, how does GBV look different for the API community? And sorry to be using kind of like these big categories as kind of we're talking about how nuance is so important.
No worries. So at the Institute, we really look at power and control as something that governs interactions between not just men and women, as we usually think of, you know, the couple, the man and the woman experiencing domestic violence, but also the relationships between men and men, women and women. And these rigid gender expectations fall upon anyone in the community, whether you identify as a man, as a woman, as gender nonconforming, just, you know, all over the spectrum. And we look at abuse as something that happens to you, that can happen to you anytime from when you were born to later in life. And so we use a model called, we call it the lifetime spiral. It basically illustrates all the different forms of abuse that Asian and Pacific Islander individuals can experience across the lifespan of their life. So that can be anything from, you know, as a young girl, because your brothers are valued more than you, you're not given access to food, a nutritious food if your family is poor, or, you know, domestic violence experience as an adult, trafficking, and then elder abuse later in life. And, you know, like I said, this occurs to both men and women and gender nonconforming folks. And so when somebody comes to, you know, receive services at a, say, domestic violence shelter, for instance, they're carrying all these past experiences of abuse with them. Not only the past abuses that they themselves have experienced, but also, you know, if they're from a historically marginalized community, if they have experienced historical trauma related to colonization, if they are have mental health challenges, or if they're, for instance, deaf or hard of hearing, if they're an immigrant, if they have language access issues, they carry all these experiences and challenges with them when they arrive at the shelter, even if in that moment they're seeking, for instance, a protective order. And so that's what we kind of talk about when we talk about intersectionality, is that somebody who's seeking services for one thing, you know, they're not just one moment of abuse they've ever experienced, it's everything. And so an advocate who approaches this person, they're going to be more effective if they know how to address, or they're mindful of everything, you know, this person has experienced, because you know, maybe something in their past is making them, you know, standoffish, and it's not because you know, it's just something they've experienced, past trauma and things like that. And from an organizational perspective, some of the work we're doing is not just to approach services as, this is domestic violence, this is sexual violence, this is trafficking, but really looking at the full picture of who somebody is as an intersectional lens.
Great, thank you so much. I think we're going to turn now to our discussion a little bit about state violence. And I wanted to touch on something that Salome asked in the chat about, like, kind of what role does economic insecurity play when we're discussing gender-based violence? What are these economic barriers? How do they manifest differently in different communities? And what can we be doing? And how can we best eradicate these economic disparities to prevent partner abuse?
I don't know if I'm supposed to answer that question as potentially the economist on this. So I think one of the if we go back to what Erica, the comment that she made again about power and control, which has been the central theme here. And I'm not convinced that the economic inequality, like eliminating that, is going to get rid of the violence that we have. What potentially will happen if we can reduce economic inequality is potentially someone have more access to resources to exit, potentially, right? But exit may not always, exit can get you out of that situation. It may not protect you long term, right? It just can remove you for the moment. And having resources allows you to put some space between you and that situation, at least for a short span. So I think that's one. I think the broader question the broader issue isn't always about the economic resources within a particular household, but it is how the larger community and the state views violence, right? And in particular, gender-based violence, and whether or not they see that as a family issue and something that they should not be a part of, or whether or not they see that as something that I'm going to really go out here and say protected under the Constitution, under the right to life and liberty, right? Now, having said that, the question is, and what does that look like? It means that you need to advocate, or we should be advocating for more resources for shelters. It means advocating for more training with respect to the police officers. So I know that in the US, my stepfather is a retired sheriff, and so I have an uncle and an aunt as well, and I will hear them talk about a police officer's nightmare is showing up to a domestic violence call. Because what happens is when they show up, you go for the party, which often in the US is the male, right? Or at least he hasn't been on the force in 11 years. So we're talking the male. And when you go for him, the wife would often, or the female in the space, would come for the police officers. In the US, that's where a lot of police officers get killed, is around responding to domestic violence issues. So I think there, a lot of that would be around how do we get some training. I think in the same way, actually, let me actually take a step back and say, one of the things that we haven't really sort of focused on is sexual assault, right? And one of the things that's happening in the US, again, which I believe is very economically based, is Title IX. So Title IX is a legislation that essentially is in place to provide equality. And we think about it more in an education, in a higher education space. One of the things that's changing around Title IX, and we'll have a blog coming out about this, is that if you accuse, it will now become a mini trial. And so our concern is whether or not the person who is the victim, who has been sexually assaulted, would have the resources for the appropriate representation, right? I think that's also the case when we're talking about violence against women. Do you have the money? Do you have the resources? If you choose to prosecute, and if you don't, I really think that the state should sanction prosecution. I'm almost tempted, and somebody will probably, put in the chat, are you crazy? Not really. I think that I'd like to see these sanctioned and in many ways thought of as hate crimes, right? Because some of what is happening is very much because of your gender, however you identify that. So my long and short of that is, I'm not sure that the economics will alleviate that. I think what we want to be advocating is for more resources for folks to take the appropriate actions to protect themselves from violence if they can.
Great, thank you so much, Rhonda. I just wondered if any of our other panelists want to jump in on this question.
Thank you, Rhonda. That was really interesting. I'd just like to add a bit of a community lens to state, not state-sanctioned violence, that would be very strong, but state ignorance. Ignorance is a form of violence, I'd say. In Scotland, particularly, what we see is there's a marked economic disengagement between amongst the Muslim and BAME community women, and there's a lack of understanding as to what's needed to bring them out of that particular state. There's been mentions of language access. There's been mention of coercive control within family regimes where women can't access. But one of the challenges we face is there's almost a state ignorance where the expectations are on the women to come up with the agency and become economically engaged without actually having an understanding that there are barriers which prevent access. So whether it's language, it can be as simple, and this is true in a lot of cases we've encountered, where women are not allowed to access language classes by the partners. Because they know if they become actively, if they can speak English properly, they'll be able to access other opportunities. So it's as simple an understanding that why aren't women accessing these classes? We are providing them. Why aren't they kind of accessing these training sessions we're providing? So it's about actually not just having a suite of measures in place, but actually seeing how these women are then able to have agency to access resources. So I think it's a lot more nuanced, where inaction shouldn't be kind of conflated with the will of not doing it.
Yeah, and just to add on to that about economic inequality, we see basically economic abuse. I think maybe Erica had mentioned this earlier, as one of the tools that abusers can use to keep their victim or survivor basically dependent upon them. We work with a lot of organizations who serve immigrant survivors, and they tell us that when you have survivors who are also immigrants, a lot of times their abuser can make them, I'm talking about domestic violence in particular in this case, their abuser uses the immigrant status as a tool to leverage, power and control. In economic terms in particular, what happens is they keep the immigrant survivor at home, not allowing them to go out and work, not allowing them to apply for the proper paperwork that they need to work in the United States. And a lot of times that survivor is coming from another country. He or she may not speak the language, may not know, basic typing skills or basic job skills for working in the US, how to file taxes, may not speak the language. And so what a lot of the agencies, the community agencies we work with do, one of the most powerful things is economic empowerment for these survivors and teaching them, teaching them skills, teaching them ESL classes, for instance, so that they are able to achieve financial independence on their own. Because what happens is a lot of times if somebody leaves their abuser, they leave the relationship, they go to shelter, and then after they go to shelter, what happens? They often have to, go back to their abuser because they were not able to become independent on their own. So just the importance of economic empowerment as well as a service that community organizations provide.
Yeah, along with what you're sharing, Shirley, I think, the end all be all isn't going to be economic stability. That's not going to be the ultimate solution, but it certainly helps, especially in the United States, especially in a society that runs by capitalism. Like one of the major concerns that we heard from survivors, right as COVID-19 was happening, right as like the stay-at-home orders were being issued, like in the US, was concerns over like housing. Like if I'm in our survivors who are in our housing program talking about like you know, are you going to ask me to leave in the middle of like the pandemic while we're doing stay at home? You know, what am I going to do if you ask me to leave? Where am I going to go? You know, and so what we did was we actually extended the length of stay at our housing program. And so we're not asking anyone to leave while there is this like stay at home order. Another thing that we saw was that most of our survivors work in the service industry, you know, and those were the folks who were like first let go as this whole pandemic was hitting. And our survivors are folks who live paycheck to paycheck. So losing your job, that's the worst thing that can happen to you. You're losing your major source of income there. So what are you gonna do, right? Like, how are you gonna pay your rent? You know, most folks, some states or communities don't have eviction moratorium, you know, policies. I'm not sure if I'm using the right word, in place, you know, so what's going to happen? And even as those eviction moratorium policies are lifted, you know, what's going to happen with the rent that's back due? How are you going to pay it, right? So those were some of the concerns that we saw in our communities.
Yeah, could I just build on that, Erica? I think that the point, let me just step back. I mean, the point about the kinds of work that people have access to, particularly in the LGBTIQ community, and particularly in countries that already are, you know, economically struggling, as it's called, you know, low and middle income countries around the world. The reality is that because of some of the prevailing social norms where access to education, I was just saying before, and employment are denied on the basis of your sexual orientation and gender identity, you find that we're overrepresented in, quote, informal sectors of employment. And so whether it's paycheck to paycheck or it's daily cash-based, you know, selling things daily on the street, or working in industries right now that are being incredibly hard hit by the pandemic. So in parts of the Caribbean where tourism is big, they're actually, you know, in the hospitality sector is where a lot of LGBT people actually work. But I think the fundamental point here is that the economic link to me is I mean, it may or may not tie necessarily to the ability to have to leave a situation, but in a lot of countries, it places people into situations that make them more vulnerable to violence. So if you don't have housing, if you're living on the street, if you are forced to return to your family of origin and be unsupported in that environment, if you're forced to or choose to go into sex work because that is the only way that you can get money to eat, then, you know, all of these kinds of situations lead to, I think, elevated risks of exposure to violence, let alone being in countries where the structures that are supposed to be available to respond to violent situations are utterly inadequate when it comes to your needs. So I'll stop there.
Thank you guys for all sharing that. I mean, we had so many more topics to talk about underneath kind of the umbrella of state violence, including criminal justice, as well as the health and social services. But due to timing constraints, I think we're going to turn to more talking about the family regime and violence within families. So I kind of wanted to touch on what Nabila had mentioned in the chat, talking about how is power and authority and how that manifests influenced and impacted by cultural norms and traditions. So.
Sorry, Shira, can you repeat the last bit of the question? I missed that.
Yeah, yes, it's how does power and authority in a household manifest and operate in the context of cultural, religious, and traditional norms?
Well, it starts when, in this context, when a female is born, a woman, you know, a baby girl is born. It starts right from there in terms of the choices that are made for that child, where they don't have agency, which school they go, how much education they receive, who do they meet, who do they not meet, what responsibilities are they given in the households. This is then also balanced with their male peers in the households, how jobs and responsibilities are shared. Then moving on, when they're kind of older, what access they have to education. What it's a spectrum. It's across the lives, and I can go on and on in this. It just depends on what point in their life they are. With BME Muslim communities, one of the kind of critical flashpoints is marriage. And what I've not really touched upon today around honor-based violence is forced marriage, which is basically, as the words speak for themselves, the people involved in that association have no say, and necessarily it's not just women, it's men as well. And they do not have any agency in choice of their partners. They don't have any agency in who they want to spend their lives with. And sometimes we've worked with the survivors who don't even know they were being forced into. So it's not a direct at gunpoint. That would be kind of a very obvious example, but it's how they're groomed across the years. Of this is who you're going to marry, this is what you're going to marry into, and you do not refuse because the family's honor is on your shoulder. So yeah, there's a whole across the range. But I'm happy to get into specifics if it's around economic control, if it's about how your children can control you. It's not just your parents, your partner, but even your children. Yeah.
Well, thank you. Yeah, I mean, if you could talk a little bit about kind of like cultural traditions, religious beliefs, but kind of from a young age, or kind of where are these silences that kind of have the biggest impact? You're talking about grooming, and what are some points of that?
So I would say I do not want to kind of stereotype, because there's so many nuances across communities, across people of different faiths, or even across different nationalities or countries of origin. But in my limited experience, it kind of manifests in kind of key milestones within our life. First would be access to education. That's almost the determining factor of how much control or agency the woman in this instance has in her life. We've heard of instances where young children have been pulled out of school. I don't think it's legal in this country anymore, but your age of 16, you don't need to educate yourself, or you're 14, 15, you don't need to educate yourself. You need to kind of stay back home and help mom cooking meals or doing whatever is needed in the household. It still does happen in my country of origin. I'm from India originally, and I'm not very proud to say that. It does happen in quite a few instances where women don't get access to education. Moving on, as in if you get into specifics, it'd be kind of partner choices. There's no control around who you can marry or be with, and no control around what you want to do with your life. And unfortunately, we've also seen instances of class here, and in the context of class, it gets a lot more interesting, where women are almost, again I speak for women because we are primarily working with BME and Muslim women who identify themselves as women, cisgender women. And what we see is women who are put through school, best of colleges, just to be the right candidate for the right, and I'm using quotes here because just to kind of get my emotions across, just to be the right potential candidate for marriage. So you could go through med school, be a highly educated doctor, but the family you marry into, they don't want you to work, but the fact that you're a doctor, you would net a good match. So that's another way it would manifest. And then you can go on to be a great mom for your kids, because you've been through a certain education system and you have had access to privileges and you're aware. It's almost like what you would call a trophy wife. That's one way it's manifested. In context of Scotland, what we've seen is a lot of control after marriage, where women necessarily don't have access to opportunities to work, and because they marry young and they have had families and they have family responsibilities, and you don't need to work if you've got, if your partner's working, you don't need to kind of bring money into the household. Again, it would be a dishonor, for lack of a better word, to the family if a woman goes out to work. That would be another way it would manifest. further on, you would see that when the children go to school, and we've seen, in some instances, we've seen that coercive control permeate into children's behaviors as well, where I'll tell dad what you did, or I'll tell grandpa what you did, or I'll tell someone what you did, to almost kind of control their parent. So yeah, those would be some of the instances we've come across.
Can I add a point? Yeah, about the drugs. Yeah. Hi. I'm also from India. Very fortunate enough to get education as a girl child. Yes, but yeah, we are evolving. Our families are evolving. They're accepting us. They know the value. If a woman is educated, she's passionate. She's the only one who is going to handle the whole family. And yes, people like cases are reducing. And talking about economic stability, the LGBTQ people, that comes in acceptance. The families themselves aren't able to accept that the child is more than another gender, girl or a female, like a male, a female. That's it, nothing else. This brings mental trauma, which even comes in school. If you identify yourself, start knowing yourself at middle school, people around you start bullying you, that lacks in education, proper education, how to learn yourself. Or if you pass through your high school, then in your work area, people start stereotyping you, judging you, giving you names, that ultimately just drain down person's mentality, and it's his or her passion to work. So we need acceptance, and yes, we are working not as bad as the India far away, but yeah, now 2020 India is evolving, and yes, we are accepting, as we are just a 2-year-old. Thank you.
I hope I pronounced your name right. Arushi? Is that?
Yeah, it is.
Sorry if I mispronounce it. Our families are very important, you know, in validating our identities and accepting us as whole people, you know, and whether or not they do that really has an impact, you know, in how we see ourselves and how society sees us as well. And just to name it, I feel like homophobia does a lot of the work of isolating survivors, you know, that in and of itself, you know, if your family does not accept you for who you are, then that's one less big support system that you can access, you know. If you're experiencing abuse in a relationship and you're not out to your family, or your family doesn't accept you for who you are, who else are you going to turn to, right? You can turn to your family of choice, or man, I'm forgetting the term for it, but your chosen family, you can turn to them. But as we know, the LGBTQ community is very small. You know, I don't know if y'all have encountered this, but I know that for myself in Boston, I feel like I know quite a lot of the community. And Boston is big, you know, it's not small, but I feel like I've seen folks like at every other LGBTQ event. So our communities are really small. And that means that if there's abuse happening within our communities, chances are that if you're going to an event and you're a survivor, you're gonna run into your abuser, you know? So what do we do with that? You know, so that's a second level of cutting off, you know, of a support system. So along with losing your family who may not accept you, you're also losing your community that you might be sharing with your abuser. But thank you so much, Arushi, for sharing that.
Thank you, Erica, and thank you, Arishi. Just to add to that, Arishi, you're absolutely right. We are catching up. And I think my reflection was not in the context of denigrating my country of origin. I'm very proud of my roots, but just a reflection that we are playing catch up, and it's going to be, you know, it's going to be a matter of time that we play catch up. And I think even in the context of violence against women, I think the women in India, we are leaps and bounds ahead on a number of issues. And I think thanks to globalization, thanks to social media, there's a lot of other things that need catching up to what the women want in India. And I think that's where the disparity is, not that we are being held back. It's that some people are moving too fast and being aware of what rights are and what is right and wrong, and then others are not able to play catch up. And I think that's where my concern is.
So I just wanted to add a consideration. So for there some Asian and Pacific Islander cultures do recognize, you know, a third gender, gender non-conforming folks, and they get a lot of praise, rightly so. So for instance, Native Hawaiians, their term, I think they say mahu for third gender, or somebody who does not fall cleanly into either male or female. The Samoans have fa'afafine. I'm sorry if I'm butchering or mispronouncing these terms, which are trans femme individuals. But we've seen from advocates that we've spoken to that even for these communities that do recognize the third gender, there are still expectations that fall upon individuals of that gender. So for instance, the Native Hawaiian mahu, they're still expected to be more feminine, or they're expected to take care of the family as, you know, a woman would. You know, they're not able to have children a lot of times in the conventional way, and so a lot of times they're devalued because they're not able to produce children. There's still expectations, and there's still roles and rigid, you know, just rigid expectations that fall upon them that can create a lot of abuse and, you know, mental health challenges.
Well, thank you, Arushi, for participating, and for our panelists as well. Just kind of looking at the time, I think we're gonna head to kind of like a wrap-up question, which is kind of, you can interpret it at whichever level you would like. So what can individuals, what can civil society and other organizations, whether women's or gender equality organizations, and also looking at the public sector and government, what can we do to support victims of GBV? What can we do to ensure an intersectional approach in our support services, in our policies? And also, what can we do as individuals during COVID-19 when we're alone, we're online, and our main form of communication is virtually, you know, cognizant of the digital divide and aware that, you know, even to just have a computer is a privilege. So I know this is kind of a really big question, so answer it however you would like, and, you know, whoever would like to speak first can go ahead.
I'll take the plunge. Keep it short and sweet. I think for me personally, we're all on a journey, and for me the first attribute I'd like to inculcate myself is a bit of reflexivity of our identity opposed to others' identity, and how we how do we engage with those identities. I think I'm constantly learning, and I think all of us are, and it's just about being reflexive of that. In terms of support, I personally don't like the word support. I think there's a whole power element even in that word there. For me, it's collaboration. For me, it's co-production with results, which means you bring in all stakeholders into the dialogue as opposed to creating a mechanism and giving it to them. I think for me, there's a bit of baggage for me there. I really detest solutions being provided to the likes of me or anybody. It's about me being part of those solutions and engaging in the dialogue with those solutions. And in terms of what states could do, I think Shirley and Rhonda would be better kind of placed to input on that. For me, it would be a recognition. State machineries are very slow moving. It takes years for policies to come into place, but there's been a lot of movement on the ground due to the pandemic, and what we've seen is an intensification and exacerbation of existing inequalities, including GBV. So I would request state machineries to kind of just oil the wheels and kind of move a little faster, in my humble kind of assessment.
So I'll chime in. And say, since you talked about policies moving forward, one of the things I've been hearing more and more about is, and of course, because I'm a data person, is in order to get the policies to move forward, one of the things we have to have is the appropriate data. And not only the data, it's a partnership that comes between an organization like mine who is pushing for the collection of data. And I put a link in the of Lee's book correct. It's called The Economic Case for LGBT Equality, Why Fair and Equal Treatment Benefits Us All, Queer Action / Queer Ideas. One of the things that Lee advocates for is data sets that will ask, I think, more broader questions about the LGBT, I think someone said IA community, community, so that there is data to analyze. But I think there's also in health surveys or in other surveys to ask the questions so that the data can be analyzed and then put together with real narratives. Without that data, and I would argue that that's the primary reason what we do not see policies moving forward, you don't get policymakers to move. So my suggestion is to advocate for the collection of data around gender-based violence, broadly defined, right? Not just necessarily violence against women, but also when women are the perpetrators against, whether it's their partners, their children, their parents, whomever the case may be. And then the second part is when you have an organization who can actually analyze that data for you, provide the narratives to go along with that so that you can take that data to a policymaker. They see the data to see what it looks like, but then they've got a face that goes along with it. I think that if it, not just in gender-based violence, but in a variety of policy issues, that's what we're missing. We're missing the narratives that go along with the data, or we're missing, did I say that right? We're missing the narratives that go around with the data, and then sometimes it's the data that goes around with the narrative, and without both, I don't think you can convince folks to change.
I'm going to jump in on that, and I know we're getting close to the end, but I mean, Rhonda, I couldn't have said it better, and I agree completely that one of the main issues that our communities face all around the world, and partly it's due to issues related to safety, to be real, but the lack of visibility and understanding and the sort of complete and utter lack of acceptance as human beings that many LGBTIQ people face around the world is, necessarily leading, of course, to increases in violence and many other forms of discrimination and exclusion. And so we need to be able to tell those stories, just as you're saying, and we at Outright try to help do that. We work very much in partnership. We're not about providing answers to anybody, and I think that's a really, really important point that Dilraj made. And I thought that speaking of stories, I just want to quickly, and I'll end here, read a quote that from our report, because we did document a lot of interviews, and this is from a transgender woman in the Cayman Islands, and it has to do specifically to COVID. It's very short. She says, for most people, the new reality of physical distancing is challenging. For those who already are isolated from chosen family, who feel unable to be out, who may not have access to supportive communities, the isolation and forced cohabitation with potentially unsupportive families or partners are extremely challenging, bringing increased anxiety, discomfort, traumatic memories, and risk of violence. Anxiety is exacerbated by socioeconomic stress and by health status, particularly for people living with HIV, who may especially be vulnerable to COVID. So I just, she kind of encapsulates a lot of the issues that we've touched on, and so I think I'll end with her words. Thank you.
I just want to add something that, as far as what we can all do. Just by being here, I think all of you who are interested in this topic, invested in this topic, and here to listen, you're already doing something to help. What we really advocate for is just breaking down this cultures of shaming and silence surrounding all of these issues, start conversations, share knowledge with each other. Because we really need to stop treating these things as women's problems or as their problems, or as, if you're not experiencing abuse, it's not your problem. It's all of our problems. We all perpetuate our cultures. We all perpetuate behaviors and expectations, especially in the US, given that there's so much attention to implicit bias and racism, there's a tendency to kind of skirt around criticizing culture. We want to treat it as sacred, but that just makes it an excuse for violence. What we need to do is to recognize that there's abuse in every culture, and culture changes. It can be changed and it needs to be changed sometimes. It's not set in stone. And the same goes for our states, our regimes. It doesn't mean that we don't love our cultures. It just means that we're not letting culture be an excuse for abuse. So.
Great point. Erica, is there anything else you want to add into this?
Yeah, I mean, I love the points that all our co-panelists are making. I really like the idea of being survivor-led. You know, the idea of letting survivors lead the discussion of partner abuse, lead the actions around partner abuse. Because we work so closely with survivors, one of the things that we like to do, one of the first things that we like to do is asking a survivor, how can I support you? What can I do to support you, you know, and not assuming that we know the answers, because we really don't. We believe that survivors are the experts of their own experiences, and we really need to act on that, you know, act out of that belief. And I mean, just to add real quick, oppression and partner abuse are linked, like I said, hand in hand, you know, and that can be daunting, I feel like, at first when you realize that, but that also means that all of us have a lot of power and a lot of agency. You have agency and power in your lives to speak out when you see any form of oppression, just as you have agency to offer support to survivors. So really, like, have these conversations with community members, have these conversations with friends about partner abuse, how it looks like in specific cultures or in specific communities, and how partner abuse looks like in LGBTQ+ communities too. Have these conversations, invite a friend to a webinar or a meeting like this or a workshop like this, and have a discussion with them about it. So I think education is key. Yeah, that's what I wanted to add.
Well, I'm not sure if our panelists have anything else they want to add. Here's a time to do that. Okay, well, I think we're all great. Well, I just wanted to say, we're gonna wrap the conversation and the conversation here. Just want to say thank you to everyone for joining this. If it's okay with our panelists, I will send you guys a question, send you guys a list of questions that we didn't get to, that kind of are the questions from the audience. And then we can share that with our audience members. So I just wanted to give a special shout out to Louisa and Thea for doing our translations into Portuguese and Spanish, which you can access through some of the links that have already been sent, and a full transcription and translation will be posted later. I also really wanted to thank Marina and Abby for all of their support handling the tech side of this, but most specifically our incredible panelists. You have been just incredible, really inspiring and insightful knowledge that I think is really going to shape all of our lives and our work as well. And just to reiterate to everyone watching that you can donate to these incredible organizations and help them continue the work that they're doing by either donating through their specific website or through our Eventbrite link. So just wanted to let you guys know our next event is tomorrow. We have 2 events on tomorrow, and one is run by Girl Up British Columbia in Canada, and it's actually a more specific conversation about the shadow pandemic and about partner abuse in Canada. So if you want to hear a little bit more about that, sign up for that on our website. And as well as we have another event called 25 Years After the Beijing Platform, its effects and results in Mexico during COVID-19. And that one is going to be run by Girl Up in Mexico. So all of these events are going to be conducted in English, but similar to this one, they will include Portuguese, Spanish, and hopefully French translations. So I just wanted to say thank you again to everyone for showing up, and I'm going to end the call here. It was lovely to meet you all.
And thank you for having us, Shira.
Thank you.
Bye.
Okay,
Thank you.
bye-bye.